And Takini is a Lakota word that means survivor, or to come back to life, to be born again. And we formed in 1992 to focus on healing from historical trauma for not just the Lakota, but other indigenous peoples as well, through therapeutic work, research, publication, prevention, community education. And then the work kept evolving, and we started to incorporate historical trauma work with parenting models and parenting curricula. So we started out with a Lakota parenting curriculum, and then we broadened it and did some evaluation on that, and I'll talk a little bit about those results later. So it started in the heart of the Lakota Nation, and that's where we started, but we've expanded and moved to working with other tribes, and we have a multi-tribal board of directors. And then we just continued our work. In 2007, I joined the faculty at Columbia University, and also joined a clinical intervention research team at New York State Psychiatric Institute's Hispanic treatment program. And I'm fortunate enough to work with two psychiatrists there that understand, respect the concept of historical trauma. And one is Roberto Luis Fernandez, the other one is Carlos Blanco, and they've been very supportive. And the kind of work they're doing there is culturally, looking at cultural adaptation for a number of evidence-based models, including interpersonal psychotherapy and motivational interviewing, just to name a few. So I had the opportunity to work with them and expanding some of this to other indigenous populations of the Americas specifically. And in one case, a woman from Mexico who was a Native woman who was experiencing depression, and looking at that. So my goal is to keep expanding the historical trauma work, developing materials, and continue to seek funding. So the historical context is important because we have all these collective experiences as indigenous peoples. There are tribal differences, but as a whole collective of people, we experience a lot of things. And Sitting Bull had a vision of uniting all indigenous people, as well as Tecumseh, which I found out that's the way you're supposed to say it. A lot of people say Tecumseh, but it's Tecumseh if I'm doing justice to the indigenous language of the Shawnee people. So, and I think there are many other indigenous peoples who had that vision. So that's something that I try to embrace. And in many tribes, people became prisoners of war. We certainly have war trauma survival stories, a number of massacres, chemical warfare, terrorism on our own land. I'm sure many of you have seen those Homeland Security t-shirts that fighting terrorism since 1492, and 9/11 was not the first attack on civilians on this soil. So we are survivors of genocide. And it's not just cultural destruction, or it's not cultural genocide, it's genocide. And later I have a slide about the UN definition of genocide. So historical trauma I define as cumulative emotional and psychological wounding across generations, and including one's own lifespan, because everything up to a minute ago is history. And then the grief that goes along with that, because there's always grief with any kind of loss, and with trauma there's always some kind of loss that's involved. And sometimes it's even just the loss of your sense of self, or your sense of control. And the historical trauma response is a constellation or group of features in reaction to the massacre trauma. And this kind of response has been observed among not only the Lakota and other Native populations, but also the Jewish Holocaust survivors and descendants, Japanese American internment camp survivors and descendants from World War II. And more recently, people in the African American community have been working with that. Dr. Joy Leary is one person. Post-traumatic slave syndrome is what she and others have been calling that. So looking at the massive impact of slavery upon people. And actually enslavement is part of Native history too, depending on what part of the country that you're from. But some of our people were also enslaved. So that's another part of our trauma. trauma theory is something that's also relevant when you look at depression, PTSD or post-traumatic stress disorder, and complicated or prolonged grief, and some of the literature on that. So you see these associations between depression, substance abuse or dependence, and post-traumatic stress disorder. And your own colleagues here, Dr. Bonnie Moran, had one study that she was involved with was show the lifetime prevalence of depression being at 44%. And for Native women, this was a primary care sample, and 86% of those women had major depression. And then the 41% had attended boarding school. And then another study that she did looked at boarding school attendance, but it wasn't significantly associated with PTSD. But then the study didn't, which she talks about, didn't look at like the quality of boarding school experiences. So as horrendous as boarding schools were historically, there's diversity in terms of the experiences of it, and there's nothing, you know, what we have to do is allow people to talk about whatever their experiences were. In my work and in my experience, the majority have been negative, but in more recent boarding schools, like one example is the Santa Fe Indian School, which is tribally run, it's been a positive experience for lots of youth. And in certain boarding schools were better than others, so there's going to be diverse experiences. And not everything is all good or all bad. So some wonderful friendships formed in boarding schools, and people just need to be able to talk about whatever their experience was and be validated for that. And then in some other studies by Dr. Spiro Manson at the National Center for American Indian and Alaska Native Mental Health Research, that's a mouthful, at the University of Colorado Health Sciences Center, they've done some studies looking at trauma, adult trauma rates of exposure, and also adolescent trauma. And that 62 to almost 70% of the adults in this study had experienced at least one traumatic event, and many of them entailed the death of, or included the death of a loved one. Now, complicated grief or prolonged grief is something that we don't hear a lot about. It's in the grief literature. And some people feel that it's hard to distinguish between that and post-traumatic stress disorder. But there are efforts to do more with that diagnosis in the DSM-4, the DSM-5. The DSM-4 is out now, but the DSM-5 is coming out. What's interesting with complicated or prolonged grief are some of these symptoms. Sadness, separation, distress, including strong yearnings or longing for the person that died, and images of the person that are intrusive. In other words, you just keep thinking about it, it comes into your mind. And of course, this is normal grief is like that. So you have to look also culturally, how long does it take a normal sort of grief process to work itself through. But this is talking about people whose grief persists or continues way after a normal grief reaction should have started to subside. And there's also psychic numbness, which we talk about as a historical trauma response feature, which means shutting down all the feelings. So you're trying to shut down the bad feelings, but you end up shutting down all your feelings, and so you don't feel much of anything. And I'll point out at the end, when we go through the video, at the end of the video, there's some boarding school slides, and there's a great slide that illustrates psychic numbing. And then just difficulty moving forward in the sense of a part of the self having died. And it may also co-occur with PTSD in like 20 to 50% of the cases. And it's unclear how much of a problem this is for American Indians, Alaska Natives, because no one has bothered to include us in their studies. That's basically the story. Most of the grief studies, at least that I've read in the literature, most of them have been on usually white middle-class individuals. And a lot of them are sort of traditional losses, like death of a spouse at sort of a socially normal kind of age. Then there have been some that have been more on ground traumatic death, but the kinds of multiple deaths that our people experience